Two new cases of COVID-19 reported today in El Paso County shows that while the pandemic is slowing, it is still a major health care issue here.
And now every patient admitted to a UCHealth hospital will be tested for COVID-19 starting this week. KRDO News Channel 13's Alexis Dominguez joins us live at UCHealth Memorial Hospital with those details. Alexis.
Bart, Heather, throughout the pandemic, UCHealth has tested about 9,000 patients for COVID-19, and that number is now expected to rise. As tests and supplies are more readily available, the hospitals are prioritizing who has the virus, no matter why they've been admitted into the hospital. After months of struggling to get a handle on reports of COVID-19 cases in the county, UCHealth staff says they now have access to enough testing supplies for the most accurate picture of how many people are sick with the virus.
Anybody that comes into the hospital for whatever reason and ends up requiring admission into the hospital gets a COVID test.
There are two types of tests for COVID-19. One is called a PCR test, which is the one Dr. Michelle Barron says patients are now taking.
It'll help us look more broadly at who has COVID, because I think we know the ones that did, but there's probably a few people that came in that we didn't know about because they never had symptoms or didn't have the classic symptoms.
The Centers for Disease Control and Prevention estimates about 35% of coronavirus patients are asymptomatic. Barron says these tests will help contain the virus to COVID-19 units in the hospital.
I hope people will realize that it's safe to come back to the hospitals, and this is just another way of trying to make people feel safe.
The change to testing applies to all UCHealth hospitals, including the 3 in Colorado Springs. As of this afternoon, El Paso County is reporting over 250 COVID-19 hospitalizations, but that number is expected to rise as they begin testing more people at UCHealth. Reporting outside Memorial Central, I'm Alexis Dominguez, KRDO News Channel 13.